Smiley, Wiley. Have a seat.
Thank you.
We'll go ahead and get started with the interview. So as you can tell, this is a pediatric office. We have two dentists here with us, Dr. Smiley and Dr. Wiley. Our mission statement here at Smiley Wiley is to help children of all ages obtain optimal oral health by providing preventive and restorative needs. In our office, we provide a happy and fun environment to help relieve stress and anxiety that some children may experience. Our goal is to make the dental experience one that is enjoyable for children, parents, and dental personnel. So I would like to thank you for sending your resume prior to this interview. I went ahead and made some copies for the dentist. They'll be in a minute. Some of the items that we look for in a resume is that it's clear and concise, which yours is. Your experience working with children, neatly prepared with white space for notes, which a lot of us will be taking notes today, and the skills applicable to our mission statement. So I think our dentists will be coming in so we can start with a few questions. So we are just going to wait on them. Oh, come in.
Hi,
Melissa.
Dr. Wiley.
Hi. Hi, Melissa. All right. So we'll go ahead and start with a few questions. Are you ready? Why do you want to work with children?
Well, I've always worked with a lot of children. A lot of times when I was in school, I did a lot of stuff at Children's Hospital and worked with a lot of kids there. And I just feel really comfortable working with children.
Why do you feel comfortable working with children?
They're just younger and I just like working with them. They're really
So
nice.
you like them better than adults?
No, I just enjoy working with them.
All right. So describe your worst experience, one of your worst experience while working with a child, and what did you do to overcome this?
One time I had a child that actually threw up on me, kind of on my leg.
Gross.
But it was all right. I told him, reassured the kid that it was okay because he was pretty upset and just kind of washed it off and then proceeded with the rest of the appointment. And he was fine with it by the end.
It does happen a lot here, so
Yeah.
good thing you have
I don't
experience.
be so comfortable from it.
All right. So, what's our next question? Dr. Wiley, would you like to go on with the next question?
Yes, of course. Let's see. What's your greatest achievement outside dental hygiene?
I would say probably community service. I did a lot with Give Kids a Smile. We funded a 5K to raise money to give underprivileged kids free dental care.
Oh, wow.
Mm-hmm.
All right, well, let's see. And describe a situation where you worked as a part of a team.
I'm also part of EFTA too. I specialized in that, and we also work one-on-one with like dental assistants as well as the dental students to do well in getting fillings.
Have you done any EFTA on children or just adults?
Mostly sealants. I haven't done too much, but I'm ready to get my hands into it and work well with them.
Wonderful.
All right.
Dr. Smiley?
Yes. How about a difficult patient? Tell me how you would deal with them.
With a difficult patient, if it was a child, probably a lot of tell, show, do, kind of show them what I was doing, try to get the anxiety at ease.
Okay, but what if they're not cooperating?
If the parent's in the room, and that's the reason why, I'd probably ask the parent to maybe step out and talk to them and try to see that, because sometimes the parents can always cause their kids not to listen too much.
All right. Well, that's a few questions that we had for you. Here at our office, obviously I'm the office manager, so I help with the interviews. We also have the dentist come in to help with the interviews. We're also always on a schedule. We're trying to exceed goals and make quotas for each month. With our hygienists, we like to do a salary plus commission. This is to give the hygienist incentive to work harder and promote the office. A little bit more about our office. Dr. Wiley?
We, every morning at precisely 8 a.m., we have a huddle so that all of our workers can come together.
Precisely at 8 a.m.
Precisely, yes. Thank
Like
you, Dr. Smiley.
8 a.m. Sure.
Okay, yes, try not
Won't be
to
a problem.
late.
Won't be a problem.
And we just go through that. It gets everyone on the same page, so everyone knows what their expectations are for the day. The con of that is a little time consuming, but we try and make it quick enough that we don't have to worry about that.
Makes sense.
All right.
After we discuss and we think that maybe you would be a good prospect, we'll bring you in for a working interview. Are you familiar with what a working interview is?
Yes, I am.
Okay. So you know that you would be coming into work for like a day, and we would show you around the office, take on some patients. Some pros to that are we'll be able to see Dr. Wiley and myself if you're actually really good at working with kids, because most people aren't. So we'll just have to see, that day. So we will be watching over your shoulder. So just be prepared for that. A little con to that would be is maybe you get a little nervous. You seem a little nervous to me today, so you might be nervous then too. But we'll try not to take that into consideration.
Okay, thank you.
So after the working interview, and if we decide that you're a good fit for our office and you decide we're a good fit for you as well, we will present you with our contract and the hygienist responsibilities. Do you have any questions about our contract per se?
What's your thing on like vacation time and sick leave and personal time?
So, vacation time, we do give vacation time and we do give sick leave and personal leave. The pros to our vacation time is that it makes the employee happy, you as the hygienist. You're more likely not to call off. Some of the cons are that you have to determine when it can and cannot be taken.
We can't have everybody out of the office at once.
Exactly.
But I'm sure it won't be a problem for you. It'll be fine.
Maybe.
Sick leave is the same. We want everyone to be happy, but personal time is basically free time the employer can take whenever. So we expect you to be here with us. We do the salary with commission, and the good thing about that is that you can make a lot of money. But a con that we see a lot in our office is that there can be, people can be pretty greedy with this. What else do you think there's in the contract?
Did you talk about the CE courses?
I didn't.
Okay, so we do offer CE courses that we pay for, but the only con of that is that it does go by our office's schedule. So if you're not available, you have to go out and do that on your own and pay for it on your own, okay?
Okay.
Dr. Smiley, anything?
I guess we would just have to see how many hours you're looking for. Are you looking for full-time or part-time?
I would like full-time, but if you can only offer part-time, I would be okay with that as well.
Okay, so if we can only offer you part-time, you won't be leaving us for a better opportunity that comes along, because we're really looking for someone that wants to stay.
Oh, I definitely would like to stay.
Okay. Well, what about benefits? Are you looking to have insurance through us? Do you have a spouse that has insurance? Because here at the office, we only provide benefits for our full-time employees.
I do have a spouse that I'd probably be under his insurance if I wasn't full-time.
So that's not an issue for you?
That would
We
not be an
cannot-
issue.
Okay, great. As far as termination, we'll have to just cross that bridge when we get to it. It just depends. But, Ohio is an at-will state, so we don't really have to give you a reason. We can just really fire you on the spot at the end of the day. Or at the beginning. It just really depends.
But
So
you seem like you could be a good fit, so let's not be too
we'll just
down.
have to see.
Okay, uniform, we provide uniforms for you. Everyone has the same uniform, so we all would like to look the same.
And Mondays we wear orange,
Yay.
Tuesdays blue, and
Wednesday's pink.
Okay.
That's
And then we'll just go over the rest when we get here.
We also do have a term in our contract for dispute management,
Okay.
just so we can, if there is a dispute among the employees, we can figure out how to take care of that. This is a really good thing in that situation. Sometimes we have this problem, but the cons are sometimes it can cause a little tension within the office, but that's okay. We deal with it. The duration of the contract, we do make a duration of our contract. It is for 2 years, so you would work with us. If you decide to quit in that time, then you aren't allowed to go to another office within 20 miles of our office. That will be in our contract. This helps us from you taking our stuff to another office. The cons are it can seem a little too dictator-like, but it works out.
It's really the best way, because we don't really want to see you around if we have to let you go anyway. It's just for the best.
So, some of our hygienist responsibilities. Do you have any questions about those?
So So I would be cleaning my own cubicles and sterilization. Do I need to provide my own instruments or?
We have instruments for you. In our office, we like to do a lot of community service. So we go to other places, other schools. If you do need education supplies, you're going to have to provide that to your patients or the students that you may see.
And then our recall system. So our office manager here can't do quite everything in the office, so we like our hygienists to go ahead and keep their own recall system, call their patients, keep that organized, so we don't have to burden with that.
Okay.
And yeah, I think that's...
One more thing, we would like you to be familiar with every different kind of aspect and job at our office, because if, say, the front desk can't make it in, they're using their sick or personal leave, we want you to be able to help them out if needed. And we also like for the hygiene to help with supply inventory, so you just keep tabs on what you need or what you don't need. That's how we pretty much do it in our office.
Okay, sounds good.
Sounds
Any
good?
questions?
No, I think we covered everything.
Okay, wonderful.
Well, it was very nice meeting you,
Thank
Melissa.
you very much.
Hope to see you soon.
Great
Alright,
meeting. I
sounds
can't
good.
wait for the working interview.
Thank you.
Nice to meet you.
Nice to meet you.
All right.